Hi, I'm Dr. Roger Levin, CEO of Levin Group, and I'm speaking to you today from our headquarters in Baltimore, Maryland. Our conversation today is about the subject of asking for referrals. Now, there's not a dentist out there that hasn't heard that you should ask for referrals, but the truth is we're not very comfortable doing it. The first thing to understand is that dentistry has some very specific guidelines that were created that may or may not be logical, rational, or applied today. There was a time that we never asked for referrals. It was almost considered unethical, but times have changed. And today, our patients who like us, have loyalty, and appreciate us are one of the best sources of opportunity to increase referrals from them. But we have to do something to motivate them. Now, as a dentist, when you ask for referrals, you're embarrassed. You feel desperate, or that they're going to think you're desperate, and it's uncomfortable. As a dentist, I recognize this, and I often in my lectures suggest that most dentists should probably not ask for referrals. But it doesn't mean that we don't need to be asking for referrals at all. The best people to ask for referrals are your staff. Now, before they ask for a referral, we've got to go through the practice and make sure there's real value. Are your systems in place? Is your scripting in place? Are patients having a positive experience? In one survey by the Levin Group Data Center, an entity that's part of Levin Group itself, we found that when we asked doctors and staff to rate how they score out of 10 on customer service, they rate themselves at a 9.2 to 9.4. But when we ask patients the same question, they rate those same practices at 7.4. So there's a gap between where the practice thinks its customer service is and where the patients believe it is. We need to fill in that gap. Now, once you fill it in with excellent practice management, you're beginning to create real value for patients. People today want more value for their money. They want a better experience than ever before. And this can only happen if your systems are in place. Now, let's assume you've got all that done and implemented. Now we ask for referrals. At every final appointment, whether it's a one-appointment case or the end of a multiple appointment case, staff members should be asking for referrals. They can be very polite, very subtle, but they need to come straight out and ask. Mrs. Jones, we love patients like you. We would be delighted if you would refer others to our practice. You need to be that straightforward. But you also need to give them an incentive. So I suggest you have a nice paper stock certificate made, and you give them one or two of these to give out to friends or family that they can use to refer to your practice. Put a dollar value on the certificate. Now it feels like currency, and they will give it to their friends and their family.